Now we're really kind of getting into the mixture of research, the mixture of actually applying some of the things that we've learned in our first semester and our first year into practice in real life. What's up, fam? Welcome back to the channel. If it's your first time here to this channel, my name is Phil Sarpon. This is Phil's Guide to PsyD. This channel is dedicated to all things clinical psychology. If you're interested in psychology, as well as if you want a little bit of a sneak preview into what grad school might look like for you, then this is the channel for you. So today I am super excited because we're actually going to go through some of the classes that I've been taking in my second year of clinical psychology doctoral school. Now, you guys may already know this, but I'm a second year clinical psychology doctoral student. And so a number of you have asked basically just about my schedule, what classes I'm taking, how many hours I'm putting into my practicum sites. And so I just kind of basically wanted to give you guys a little bit of an update to some of the classes that I'm taking this year in my second year as a PsyD student. So in the fall semester, one of the classes that I took was called Practicum 1. Now, I've mentioned this before. Basically, how clinical psychology goes is that the first year for me was mostly just classes, and we had Thursdays and Fridays off. But now we have classes from Monday through Wednesdays, and Thursdays and Fridays are usually dedicated to actually spending time in our practicum sites. We're really basically taking the knowledge that we've learned in our previous classes and actually putting them to practice. So we might have a lot of different case studies. So Practicum 1 is 2 credits. The next one is Practicum Seminar, where we actually give mostly presentations of different case studies of clients or patients that we've had, how basically we would diagnose different patients, or how would we actually go through with different treatment options. And so it's really giving the class basically an idea of what it would look like to actually be a psychologist. We get to hear from a number of different faculty members and professors about maybe some complex cases that they've had. And so this is really just giving us an idea of what we're actually going to do once we're psychologists. The other one is a diversity class, which is pretty self-explanatory. We're going to learn about diversity, and diversity is one of those things that's super, super important as a psychologist. Understanding that there are cultural components to doing therapy with different people from different backgrounds, different ethnicities, as well as different treatment options based on different ethnicities. And so we're going to go through a diversity class. The other thing is a family theories systems course, where we learn about family therapy, we learn about different family dynamics and how to go through family therapy, couple therapy, all of those different things. So that's the next class, which is 3 credits. The diversity class was 3 credits. The other one is clinical research and stats. We're actually learning really the heavy stuff about stats. We're learning basically how to collect data, how to analyze that data, how to run it through different programs. Class is actually going to really help us obviously for our dissertation, and so it's important to kind of know these fundamentals in order to be able to do our research and our dissertation in the future. The next one is a Research Lab 3, which is a 1-credit class where we basically just go over things that we're doing in our dissertation with our faculty member, our lab director, and basically just the progress of going through our clinical research and working on our dissertation. Now we're really kind of getting into the mixture of research, the mixture of actually applying some of the things that we've learned in our first semester and our first year into practice in real life, especially as we go through 3 days of classes and then 2 days really devoted to that time in our clinical practicum sites. So spring semester looks kind of similar. We have Practicum 2, which again is 2 credits. And then we have Practicum Seminar, which is 1 credit again. And then we have a class called Biological Basis of Behavior, which is 3 credits. And as the name kind of sounds, this is where we actually go through the systems of the body. As you know, the mind is not only just itself, it's also connected to the body. And so when people go through different mental health conditions, it tends to also affect their physical conditions and symptoms as well. And so we're basically just learning about the human body in that sense. Now, it's not going to be as in-depth as perhaps a medical student going through an anatomy class or going through a physiology class. But I do think it's especially important as psychologists, future psychologists, to understand just general knowledge of the body. So that's going to be biological basis of behavior. Next one's going to be clinical research and stats. And so again, this is where we're really synthesizing that research, that information, so that once we start going through our research plan and the methods and the sections and all of that stuff, we kind of know exactly what we're doing. And then lastly is going to be just another research class where we can actually work with our faculty member. That is fall and spring semester. Summer semester, we're actually going to take 2 classes. It's going to be advanced social psychology and then cognitive and emotion. So those are 2 classes that we'll get done in the summer, and then we're going to be getting ready for our comprehensive exam, which is basically an exam where from the first year and the second year we have to study all of those classes, and we take basically a comprehensive exam which includes anything from first year and second year. And so that's really more of the head knowledge. That's basically what the schedule looks like from fall to spring and then finally in the summer. So hopefully that gives you guys a little bit of a better idea of what my year is looking like, what I'm doing with my clinical therapy sites, and also what I'm doing with school. If you guys have any questions about my schedule, definitely put it down in the comment section below. If you have not already done so, definitely smash the like button, give this video a thumbs up, and also subscribe to the channel if you have not already. All right, so that takes care of this video. I will see you guys in the next video.